Hi, this is Dr. Nina Naidu, and I'm just going to go through a few of the most frequently asked questions that I receive about breast augmentation surgery. So one of the most common questions I receive at the preoperative and initial consultations is, can I breastfeed following breast augmentation surgery? Most patients are able to breastfeed following surgery. There are two recent studies that have been done in the past 5 to 10 years which showed at least a 94% success rate in breastfeeding with either the inframammary, that's underneath the breast, or the periareolar, that's below the nipple-areolar complex, incisions. And there was no statistical difference between the two. The ducts to the nipple are not touched during surgery, so theoretically you really should be able to breastfeed. Obviously, there's no guarantee of that, but from an anatomic point of view, there shouldn't be an issue. What is the recovery time after breast augmentation? So keep in mind that every patient is different and every surgeon will have different recommendations. But in my experience, most patients have fully recovered by about 2 weeks following surgery. So again, follow the specific recommendations of your surgeon. What I recommend for my patients is that they avoid any heavy lifting, exercise, or sexual activity for 2 weeks after surgery, and this includes running, yoga, and upper body weightlifting, which may take about 3 weeks. It is okay to shower the same day. I have no issues with my patients showering, and that actually helps them to start moving around a bit faster. They may return to work in 3 to 4 days, depending on the type of work they do. So for patients who have a desk job, I'll let them go back to work in 3 to 4 days. If I have patients who are doing a lot of heavy lifting at work, a lot of my patients are nurses, I will have them hold off for a good 2 weeks before they go back to work. Most sutures will dissolve in about 3 months. Again, it depends on what your surgeon is using, but for what I use, there'll be one set of sutures that resolves in about 6 weeks, and the other will dissolve in about 3 months. Will my breast augmentation scars fade? Everyone's different. Scars will fade at different rates depending upon your skin tone and quality and the type of closure that you had as well. The key to producing good scars resides in both the quality of the wound closure and the reduction of tension on the incision, which is why plastic surgeons do spend a lot of time closing their incisions. Scar creams work, but you have to be compliant. If you're not using it, it's not going to work. The ingredients are important too. Silicone has traditionally been an important ingredient in most medical grade scar creams and gels, and massage of the scar helps to break down the scar tissue. In my own practice, I have moved from a silicone-based scar cream because I found that most patients were having reactions to this, and I created my own scar balm, which contains rosehip seed oil, sea buckthorn seed oil, and Centella asiatica, among other ingredients. These ingredients have been shown in clinical studies to help with wound healing and decrease scarring. How much pain will I have after breast augmentation surgery? Pain is incredibly subjective, but in my practice, I find that most patients will have mild pain after surgery, which lasts for about 48 hours, and it seems to really diminish significantly at that point. Severe pain can indicate bleeding, so if you have severe pain after breast augmentation surgery, call your surgeon. Pain medication varies from surgeon to surgeon. I use an anti-inflammatory medication for my patients. I specifically prescribe ketorolac or Toradol, which has been shown in clinical studies to reduce pain without creating an increased risk of bleeding. I don't let patients use Motrin or Advil or other anti-inflammatories because those are associated with bleeding. I no longer prescribe narcotics in my practice. I found that the vast majority of patients do not need them, and I find that by not using narcotics, you can get up and get back to your regular activity a lot faster. I haven't seen any significant differences in pain with the subglandular versus a submuscular or dual plane position, that is, with placement of the implant above or below the muscle. The traditional thought is that putting it underneath the muscle creates more pain, but if the surgeon is doing your surgery gently and without too much trauma to the tissues, you should have similar recovery times with both operations. So limit activity as directed by your surgeon and just listen to your body. If anything hurts, stop. For more information, please visit my website at naiduplasticsurgery.com, or you can give us a call at 212-452-1230. If you have any specific questions, go ahead and put them in the comments below and I will do my best to get to them.